Today, we're getting under the hood of women's health with Dr. Taniqua Miller, a board-certified OBGYN and women's health physician, empowerment coach, a midlife menopause health expert, and the founder of Revival, a menopause telemedicine company. Dr. Miller will get under the hood of hormone replacement therapy. So, what exactly is HRT and how does it work?
HRT stands for hormone replacement therapy. Hormone replacement therapy is a little bit of a misnomer here because in the menopausal world, we're trying to rather supplement that estrogen to help most with symptoms. We know that as you go through the perimenopausal transition and estrogen levels start to decline, that's the cause of the symptoms of the hot flushes, the night sweats, or even that vaginal dryness that some of us may experience over time. So we're giving back just enough estrogen to help mitigate some of those symptoms.
What are the benefits of HRT for perimenopause and menopause symptoms?
We think of perimenopause, we break perimenopause up into early phase and late phase. In that early phase, that's when we're starting to notice some of the first signs. So, some menstrual cycle changes. And for many women in this stage, we feel as though we can manage some of those symptoms. Sometimes it's a question mark, are we actually in perimenopause? But the big symptoms that we think about, like hot flushes, night sweats, haven't really started very much at that time. However, in the late perimenopause phase, defined as having menstrual cycles greater than 2 months apart, we start noticing more of those troublesome symptoms that are really disruptive, like the hot flushes, like the night sweats, like the sleep disruption. And so, for some patients, they really can benefit from hormone therapy because it really helps to mitigate those symptoms so that they're not going through periods of stress, they're not going through periods of sleep disruption, they're not going through periods of that significant mood changes that they may be experiencing. I like to offer patients hormone therapy when they're having symptoms such as these that are really disrupting their lives. Because I know that even supplementing just a little bit of estrogen, that helps when we're thinking about how severe the symptoms are. In fact, if you're having very severe symptoms, namely heart palpitations, significant night sweats, significant hot flashes, we know that there are some long term risks that are associated with that, especially from a cardiovascular health like heart attack and stroke. And so it's a great time to consider hormone therapy in this late perimenopausal phase through into menopause.
What are the risks associated with HRT and who should avoid it?
For the first time, that WHI information, he literally like went line by line. There were like so many contradictory statements in that paper, and it still got published. Like literally, like it said nominally
Mm.
not significant, and then like they said that it was significant. Like it just was wild. So anyway, I'm trying to get that out of my head because that I don't need to talk about that. Okay. All right, risk. Some women have big concerns about hormone therapy, especially since that 2002 study from the WHI maybe showed that there was some increased risk associated with hormone therapy, including additional risk of breast cancer, stroke, blood clots, and heart attacks. And I think these risks are potentially real and what something to definitely think about when you're considering hormone therapy. But here's some good news. The timing of hormone therapy is important, and the type of hormone therapy you try is also important. So, for patients generally who are healthy without very many medical issues or well controlled issues like hypertension and diabetes, hormone therapy can be a very safe option. But there are some patients that we do wish to avoid hormone therapy in, namely patients who have a history of an estrogen receptor cancer, such as breast cancer or endometrial cancer, patients who have a pre existing condition like coronary artery disease, a previous history of heart attack or stroke, previous history of blood clots, or even patients who have unexplained vaginal bleeding. So, anytime we're making a decision to start hormone therapy, we want to make sure that we're really reviewing a thorough medical history and counseling patients on those risks, but then also those benefits. And those benefits are best felt if given hormone therapy within the first 10 years of symptoms before menopause or under the age of 60.
What are the different types of HRT and how do I know which is right for me?
Mm, I don't know. No, just like unlike in the past where we really had one formulation of hormone therapy, Thankfully, today we have so many different types of hormone therapies, from oral pills that you can take on a daily basis to patches that you wear weekly. There really are options for every type of patient, every type of person who really wants relief from their menopausal symptoms. So, one of the first questions that I ask patients is, what is your lifestyle like? If you're a pill person and you want to be on pills and you don't have other risk factors that would preclude you from being on pills, then yeah, I think a pill would work really, really nicely. If you're a patient, for example, who has a smoking history, I probably would avoid a pill, but offer you something like a patch, which has a lower blood clot risk and can be used safely in that scenario. Whatever your lifestyle is, or whatever types of options that you think there are, there definitely exists for hormone therapy. So there's always a good way to talk with someone who's really experienced, who knows all of these options to make sure that you are getting the treatment that most appeals to you.
How long can I or should I stay on HRT?
Question always comes up of, when should I stop my hormone therapy? And I will say it depends. So for some patients who start their hormone therapy during perimenopause, they will in fact transition through to menopause and maybe stay on it for a few years. Some patients at that point decide to stop it, and in a way that will help prevent the recurrence of symptoms. So I generally recommend that if you are on hormone therapy and wish to stop it, that you do so under the advisement of a menopause specialist. But for some patients, they either want to stay on it because they feel better, or they want to wean, but then they notice that they have increased symptoms when they do so. So in that situation, there's actually some data that continuing your hormone therapy, if it's been initiated within that 10 years or under the age of 60, may be okay. Again, this is a conversation that you would have with your menopause specialist to see exactly what your goals are. Referring to making a decision to stay on your therapy, I'm really referring to systemic therapy, meaning the pills and the patches. But we do know that there is a condition called the genital urinary syndrome of menopause that seems to be more progressive. The vast majority of patients may, in fact, notice that their symptoms of hot flashes and night sweats actually improve after the menopause, which is 12 months of no menstrual bleeding. While those symptoms tend to improve, symptoms like vaginal dryness, painful intercourse, or even urinary symptoms like urinary frequency and urgency, that might actually worsen over time. And thankfully, we have options that are localized, so not systemic, that we can use directly into the vagina to actually treat those symptoms. So, for some of my patients, while they may feel that they no longer need their systemic therapy, we might in fact decide to continue the localized vaginal therapy, knowing that these symptoms of vaginal dryness and painful intercourse can actually worsen with time. Additionally, I would also say that for patients who are at high risk for osteoporosis, this is when you have such low bone density that increases your risk for hip fractures, which can be so devastating in later life with loss of mobility, loss of independence, and even mortality. It is FDA approved to use estrogen for the prevention of osteoporosis. So, for some of my patients who are doing well on their hormone therapy, they're otherwise healthy, but they are at increased risk for osteoporosis based on their family history or even their own diagnosis of osteopenia. It might be a conversation where we talk about even just keeping a low dose of estrogen, such as a low dose patch, in place for as long as they would like to still offer that benefit for the prevention of osteoporosis.
Does HRT help prevent long-term health issues like osteoporosis, heart disease, or cognitive decline?
The data that we have about the impact of menopausal hormone therapy on heart disease or cognitive decline or even osteoporosis comes from those earlier studies back in 2002 from the WHI. And what they did show is that for the patients who were younger when they initiated therapy, they called them the young group, the 50 to 55-year-olds, that they did see some long-term benefit from cardiovascular and neurocognitive decline. But I think it's important to note that patients who were initiated on therapy and the average age of 62 actually had a worsening in these figures. So that's where the recommendations for starting hormone therapy within 10 years of the menopause and under the age of 60 comes from. For a lot of patients, it's called the timing hypothesis, making sure that you're taking the hormone therapy at the right time as closely as possible to when the estrogen levels start to decline. And so we might see some benefit there. But I think it's really important to note that the Menopause Society does not recommend using hormone therapy for the prevention of neurocognitive decline or cardiovascular disease. There is one exception there, and that has to do with osteoporosis. We know that estrogen is, in fact, FDA approved for the prevention of osteoporosis. And so, for those patients who are also experiencing symptoms, it may be worthwhile to start an agent like a menopausal hormone therapy plan with estrogen in it because it does offer that bone protection.
Is there an optimal time to begin HRT and to stay on it?
Many patients sometimes ask me, Dr. Miller, when is a good time to consider starting hormone therapy as I'm going through this perimenopausal journey? I don't want to start it too early. I don't want to start it too late. What would be a good time? And here's what I say. If you're having symptoms that are so disruptive that you feel as if you can't function, or you're starting to feel those first symptoms and you want to kind of like steer them off, then my recommendation is to consider hormone therapy. The good news is that we know that as you travel through the perimenopausal transition, that your hormone therapy requirements may in fact change. So for some patients, they may start on a low dose of hormone therapy and over time increase their dose, get to a place where they're feeling better, go through the menopause, and then may decide to slowly decrease the dose over time. For patients who have a history of osteoporosis in their family or have personal risk factors for osteoporosis, they may in fact recommend staying on hormone therapy and even staying on low doses past the age of 60.
Are there natural or bioidentical alternatives to traditional HRT, and how do they compare?
Those patients who wish to have other options that don't necessarily focus on hormones themselves, there are a lot of options that are available. There are options that mimic estrogen activity, such as phytoestrogens, under the brand names like estrogen. And there are other options in terms of acting on areas in the brain that we think estrogen receptors also are. And we see that in products like Black Cohosh or S equal. It's important to talk to your provider about whether or not these options are good and safe for you. For example, excess doses of Black Cohosh, while effective for symptoms of vasomotor symptoms, can in fact cause some liver issues. So we want to make sure that whatever you're doing it in a way that is safe and under the care of your clinician.
What are the most common side effects and how can they be managed?
Side effects of hormone therapy include breast tenderness, headaches, bloating, even sometimes an increase in hot flashes initially, if that was a symptom that you were experiencing. Thankfully, these symptoms are short lived, lasting between 2 and 4 weeks, and are generally managed with over the counter medications like ibuprofen or acetaminophen, Tylenol. For those patients who have ongoing symptoms like bloating, sometimes switching up the type of hormone therapy you're on can make all the difference. And that's something that I would encourage you to talk with your clinician about. The other big side effect that most people experience is unscheduled bleeding. And for someone who is menopausal, for example, who hasn't had a period in over a year, that could be a little concerning. But believe it or not, when you're initiating hormone therapy, unscheduled bleeding is quite common and is considered normal for the first 4 months of therapy. There are things that you can do to adjust your therapy to address the bleeding, and again, should be worked with your clinician so that we can relieve those symptoms. Any symptoms that seem to exceed greater than 6 months of bleeding or seem abnormal, like heavy bleeding, passage of clots, or prolonged bleeding, would require in-person referral.
What will your top 5 tips be around HRT?
Ever been on social media, you can see that menopause is having a movement, not even a moment. And here are my 5 tips to really navigating this transition when there's so much information out there and it's really hard to know what to do. So, the first thing is to understand that there is no one size fits all to hormone therapy. You're an individual, and your experiences, your goals, and your needs will be different from other people. So, really encourage you to partner with a clinician who's willing to work with you to meet your goals. Not everybody's goals are the same. In fact, you might feel okay with a vaginal estrogen, but might want to try some supplements for your other systemic symptoms, or vice versa. And so I think it's important to understand that what you're hearing, all of the information about how to do menopause the right way, is not always correct because it really isn't a one size fits all. The second thing that I would say is use this time as an opportunity to manage chronic medical conditions. I have a lot of patients who say, well, how do I optimize my health? Will hormone therapy help me? And while there are some advantages, as we discussed with the timing of your hormone therapy, it does not replace management of chronic medical conditions like high blood pressure or diabetes. That we know that when you have chronic medical conditions, especially those conditions that will disrupt like the microvessels in the brain and in the heart, those are the things that would increase your risk of cardiovascular disease as well as neurocognitive decline. And so while we're enjoying the benefits of hormone therapy, we also don't want to forget that making sure we're staying up to date with all of our other chronic medical conditions is just as important. And my tip three is really look towards the future. We know that we have almost 30 or 40 years after the menopause. If the average age of menopause is 51, we know that we live a third of our lives after that. So, how do we prepare for the future? How do we want to show up in the second act of our lives? And so, this is where I encourage you to dial in your nutrition, really focusing on longevity. That's where we talk about strength training to really build up those muscles to help support you over the next several decades, dialing in nutrition and exercise, and also remaining engaged. There was this great study that looked at, how do we enter our later years being more neurocognitively intact? And one of the big things, other than managing chronic medical conditions and having good aerobic exercise, was remaining engaged. So many times we become lonely the older that we get. And so finding the things that you enjoy, finding the things that really speak to you, and being engaged in community is one of the biggest things that you can do to really create this second act in a way that's going to give you that vitality and the longevity that so much of us want. The fourth tip is don't forget the vagina. So, genital urinary syndrome is real. Genital urinary syndrome is a constellation of symptoms that is a result of low estrogen. So, even for my patients who decide to wean off of systemic hormone therapy like a patch or a pill, it's important to note that the vaginal changes tend to be progressive. And in fact, if you've ever heard of people having recurrent urinary tract infections, which sometimes can require a hospitalization, or they're having vaginal dryness and discomfort, or they're having urinary symptoms like incontinence or urgency or frequency, this in fact can be helped with local doses of estrogen, which are not systemic and relatively safe for the vast majority of people, even when you opt to stop your systemic therapy. So if you're someone who's experiencing recurrent urinary tract infections or just uncomfortable symptoms like leakage or urinary frequency or urgency, please make sure that you're paying attention to your vagina and know that there are interventions that are safe, that are not necessarily systemic, that can be continued really for a lifetime. Tip five is to start early in your conversations around hormone therapy. There is so much data now that tells us that hormone therapy is not only safe, but can be actually beneficial when given at the right time and with so many different formulations to really meet the goals of everyone that would be a candidate. I encourage you to meet with a menopause specialist to talk about whether or not it's right for you. I would say that when we give recommendations for within the first 10 years or under the age of 60, we're giving those recommendations based on studies that have happened in the past. And for 20 years, women were so afraid to take hormone therapy because these same studies really caused a lot of conflict for these patients when we look at risk of heart attack, blood clots, and even breast cancer. But what I would like to say is that we now have come 20 plus years later, and we know that these options are safe. And we know that patients can really make informed decisions when they're partnering with the people who really know this medicine really, really well. So if you feel afraid of menopausal therapy because of what you've heard and the studies of the past, I encourage you to be educated. Be educated about this. And there are so many great books that talk about the menopause transition in general, including hormone therapy, so that you yourself can know whether or not this is something for you. And partner with someone who knows menopausal medicine well so that you can feel as empowered and informed as possible.